Hello, I'm Dr. Reshma Rakshit, a consultant gastroenterologist. Today I wanted to talk about eosinophilic esophagitis, or EoE in short. This is an uncommon condition in general, but is becoming increasingly common. I see about 10 to 15 patients a year with newly diagnosed EoE. And today I wanted to talk a little bit about what it is, how to diagnose, and how to treat it. No one really knows the cause of EoE. It's thought to be an allergic condition where certain cells in our body called eosinophils, which are a type of white blood cell, they increase in the digestive tract, including the gullet or the esophagus, and cause inflammation. The inflammation takes over a long period of time to cause long-term damage and scarring in the gullet. And these can cause symptoms. So what symptoms do people with EoE have? Well, the commonest condition is difficulty in swallowing or dysphagia. This can be mostly with solids, and often people over a long period of time develop coping mechanisms. Some people also get pain while swallowing. And often I find patients telling me that they take a long time to chew food, they take a long time to eat, and they're usually the last ones to leave the table. Often they're drinking lots of water or fluids with their drinks and can avoid certain foods that they've had trouble with in the past. I've had some patients who find it so distressing that they have to stand up, tap their or hit their chest to allow the food to go down, and then resume eating. As you can imagine, this has quite a significant impact on their social life and eating out with friends or relatives. As it's not known commonly, the symptoms can be ongoing for a long period of time before patients are diagnosed. In the past, this was thought to be very common in children, but not adults. But over the last 10 to 15 years, increasingly adult gastroenterologists are diagnosing patients with this condition. A very common presentation in hospital is called food bolus obstruction, or when food gets stuck in the chest. Often this needs to be removed via an endoscope or a camera to allow the person to stop developing symptoms. Do we know the cause of EoE? Well, we don't so far. There are a few associations. So patients who have an allergic history, for example, hay fever, runny nose, eczema, asthma, or they have a family history of allergic diseases, they can develop this condition. So if you're developing any of the symptoms I spoke about, please see your doctor and you can be referred on. How do we diagnose EoE? The main way of diagnosing it is with an endoscope. So this is a flexible tube that's passed through your mouth into your gullet and into your stomach. This allows us to pass a very small biopsy forceps through the endoscope and to take some tissue samples from your gullet. These are then looked under the microscope and a diagnosis can be made very confidently and very easily. This is the first step to recovery. There are quite a few treatment options nowadays. The first and most common is acid-suppressing medication called proton pump inhibitors. These help a small number of patients. There are also other medications like steroids, which are used as inhalers that you may have seen asthma patients have. Instead of breathing in the inhaler contents, you would want to swallow them, and we can teach you how to do that. However, the most exciting news is that over the last 2 or 3 years, we've had a new drug called Jorveza that's arrived. This is a tablet, and this has been shown to work very well in EoE patients. It's a little tablet that's placed on the tongue and it dissolves, so you don't have to swallow anything, and it coats your gullet and reduces inflammation. Apart from that, there are non-medicated ways of treating EoE, and this is done with the help of a dietitian and excluding certain foods. This is not as easy as it seems, and I've found that in adult patients this can be tricky because we can be excluding 2 to 6 food groups. However, the main way of knowing whether the medication is working is not just by your feeling well, but by us looking down with the camera and taking biopsies to show that the number of eosinophils in your gullet is reducing. As of now, there is a lot of research going into this field, and new drugs are coming up all the time. There are various EoE charities now available, one in the UK called EOS Network, that can really help. Patient education is key, and understanding that you are not without help is really important. So come along, come and see me, and I hope to be able to help you manage this long-term condition successfully. Thank you.